Welcome to the channel. Tuberculosis, or TB, is one of the oldest yet most persistent infectious diseases that continues to affect millions of people around the world every year. Despite major medical advancements, TB remains a significant public health challenge because of its contagious nature and the way it silently develops in the human body before showing symptoms. The disease is primarily caused by a bacterium called Mycobacterium tuberculosis, which typically attacks the lungs but can also affect other organs like the brain, kidneys, and spine. Understanding how TB spreads, what symptoms it causes, and how it can be diagnosed and treated is vital for prevention and recovery. When we think about TB, we often associate it with severe coughing or weakness, but in reality, the disease can exist quietly for months or even years before a person realizes something is wrong. This makes early awareness and proper diagnosis essential for stopping its spread. TB spreads through the air when a person with active pulmonary tuberculosis coughs, sneezes, or even talks, releasing tiny droplets that contain the bacteria. People nearby can inhale these droplets and become infected. However, it's important to know that not everyone infected with the TB bacteria becomes sick immediately. In many cases, the bacteria remain inactive in the body, a state known as latent TB infection. During this phase, the bacteria are alive but dormant, causing no symptoms and not being contagious. The immune system keeps them in check, but if immunity weakens due to stress, malnutrition, or illness like HIV, the bacteria can become active, leading to active TB disease. This transition from latent to active TB is what makes it so dangerous because the disease can suddenly manifest with full force when the body is least prepared. One of the earliest signs of active TB is a persistent cough that lasts more than 3 weeks. This cough may produce phlegm and sometimes even blood, which is a clear warning sign that should not be ignored. Along with the cough, patients often experience fever, night sweats, fatigue, and unexplained weight loss. These symptoms can easily be mistaken for other conditions like flu or pneumonia, which is why TB often goes undiagnosed until it becomes severe. In many developing countries, people may not seek medical help early due to lack of awareness, access to healthcare, or social stigma, allowing the infection to progress and spread to others. When TB affects organs other than the lungs, it is called extrapulmonary TB. This can involve the lymph nodes, bones, joints, kidneys, or even the brain. Symptoms vary depending on which part of the body is affected. For example, TB in the spine can cause back pain and stiffness, while TB in the kidneys might lead to blood in the urine. TB meningitis, which affects the membranes covering the brain, can lead to severe headaches, confusion, and even coma if not treated in time. Because these symptoms mimic many other diseases, doctors often need detailed investigations to identify TB correctly. Diagnosis of TB usually begins with a medical history and a physical examination. Doctors ask about symptoms like persistent cough, fever, and weight loss, as well as any history of contact with a TB patient. The most common diagnostic test is the sputum smear microscopy, where a sample of mucus is examined under a microscope for the presence of TB bacteria. However, this test can sometimes miss cases, especially when the bacteria are present in small numbers. More advanced tests like the GeneXpert or PCR-based tests can detect TB bacteria more accurately and also identify drug resistance. Chest X-rays are also commonly used to look for abnormalities in the lungs that suggest TB infection. In some cases, especially for extrapulmonary TB, doctors might take tissue samples through biopsy or use imaging scans like MRI or CT to identify affected areas. Blood tests like the interferon gamma release assays, IGRAs, can detect latent TB infections and are particularly useful for people who have been exposed but do not show symptoms. Early and accurate diagnosis is crucial not only for the patient's recovery but also to prevent transmission to others. The earlier TB is detected, the better the chances of a full cure and reduced spread in the community. Treatment for TB typically involves a combination of antibiotics taken over several months. The standard treatment for drug-sensitive TB lasts 6 months and includes 4 key medications: isoniazid, rifampicin, pyrazinamide, and ethambutol. These drugs work together to kill the bacteria and prevent them from developing resistance. The treatment is divided into 2 phases: the intensive phase, where all 4 drugs are taken for the first 2 months, and the continuation phase, where isoniazid and rifampicin are continued for another 4 months. It's very important for patients to take their medication regularly without missing doses because incomplete treatment can lead to drug-resistant TB, which is much harder and more expensive to treat. Drug-resistant TB occurs when the bacteria develop resistance to one or more of the standard anti-TB drugs. This form of TB is more dangerous and can take up to 2 years or more to cure, often requiring stronger and more toxic drugs. Multi-drug-resistant TB, MDR-TB, resists at least isoniazid and rifampicin, while extensively drug-resistant TB, XDR-TB, resists even second-line treatments. This makes managing TB more complex and highlights the need for supervised treatment programs like DOTS, directly observed therapy, short course, where healthcare workers ensure patients take their medication consistently. Beyond antibiotics, TB treatment also includes proper nutrition, rest, and monitoring for side effects. Many TB drugs can affect the liver, so regular checkups are needed to ensure the patient's body is handling the medication well. Patients are advised to eat foods rich in protein, vitamins, and minerals to strengthen their immune systems. Fresh fruits, vegetables, whole grains, and lean meats are particularly beneficial. Avoiding alcohol and smoking is also critical since both can interfere with treatment and slow recovery. The emotional impact of TB can be just as severe as the physical symptoms. Many patients face stigma or isolation, leading to anxiety and depression. Mental health support plays an important role in recovery. Support groups, counseling, and family encouragement can make a huge difference in helping patients stay positive and complete their treatment successfully. Preventing TB starts with awareness. Vaccination with the Bacille-Calmette-Guerin (BCG) vaccine provides protection, especially in children, against severe forms of TB like meningitis. Maintaining good ventilation in living spaces, covering the mouth when coughing, and ensuring early diagnosis and treatment of TB patients are key steps in breaking the transmission chain. For people with latent TB infections, preventive therapy with medications like isoniazid can stop the bacteria from becoming active. TB is closely linked with social and economic factors such as poverty, overcrowding, and malnutrition. People living in poor housing conditions or with limited access to healthcare are at higher risk. Strengthening public health infrastructure, improving nutrition, and ensuring access to timely medical care can go a long way in controlling TB. Countries that have invested in TB awareness campaigns, community-based treatment programs, and free medication distribution have seen significant declines in TB rates. Global organizations like the World Health Organization, WHO, continue to lead initiatives to eliminate TB. The WHO's End TB strategy aims to reduce TB deaths by 90% and cut new cases by 80% by 2030 compared to 2015 levels. This ambitious goal requires cooperation between governments, healthcare systems, and communities. Every person treated successfully for TB contributes to breaking the cycle of transmission and bringing the world closer to a TB-free future. Even though TB has been known for centuries, misconceptions still exist. Some people believe TB only affects the poor or those in developing countries, but that's not true. TB can affect anyone, anywhere, especially people with weakened immune systems, diabetes, or other chronic illnesses. Travelers, healthcare workers, and those living in close quarters like dormitories or prisons also have higher risk. Raising awareness about TB symptoms is crucial. If someone has a cough lasting longer than 3 weeks, chest pain, or coughing up blood, they should seek medical attention immediately. Early testing saves lives and prevents further spread. Families should also support affected members instead of isolating them. Compassion and understanding go a long way in helping patients recover faster and adhere to their medication. When a person begins TB treatment, the first few weeks are crucial because this is when symptoms begin to improve and the patient starts feeling better. However, this improvement can be misleading. Many people stop taking their medication early because they think they're cured, but the bacteria still remain in the body. If treatment is stopped too soon, the remaining bacteria can multiply again and become resistant to the drugs that once worked. That's why completing the full course of treatment is not just important. It's essential for survival and for preventing the disease from spreading to others. Doctors and health workers constantly emphasize that even if a patient feels healthy after 2 months, the full 6-month course must be completed without fail. TB treatment success depends heavily on consistency and supervision. The Directly Observed Therapy (DOT) program was introduced to ensure this. Under DOT, a healthcare provider or trained volunteer watches the patient take each dose of medicine. This system not only guarantees compliance but also provides emotional and educational support to patients. Many people, especially in rural or underprivileged areas, lack knowledge about the disease, so continuous counseling under DOT helps them stay motivated throughout the long and sometimes challenging treatment period. Drug-resistant TB adds another layer of difficulty. The medications used to treat MDR-TB and XDR-TB can cause side effects such as nausea, hearing loss, joint pain, and liver problems. Despite these challenges, patients must continue treatment under strict medical supervision. The development of newer drugs like bedaquiline and delamanid has improved outcomes for resistant cases, but they must be used responsibly to prevent further resistance. Global health authorities are also working toward making these new treatments affordable and accessible in low-income regions, where the majority of TB cases still occur. Nutrition is a cornerstone of TB recovery. When a person suffers from TB, the body is in a constant battle against infection, which increases the need for energy and nutrients. Weight loss, fatigue, and weakness are common because the bacteria consume the body's resources. A balanced diet rich in proteins helps rebuild tissue, while vitamins like A, C, and E strengthen the immune system. Iron and zinc are also important for blood and cell repair. Foods such as eggs, fish, chicken, legumes, nuts, fresh fruits, and green vegetables should be prioritized. Hydration is equally vital since many TB medications can strain the kidneys and liver. Patients are encouraged to drink plenty of water to help flush out toxins and maintain energy levels. Sleep and rest are equally important in the healing process. TB drains the body's strength, and sufficient rest allows the immune system to focus on fighting the infection. Overexertion can delay recovery, so patients are advised to balance light activity with adequate relaxation. Gentle exercise, such as walking, can help improve lung function once a person starts feeling better, but it should always be done under medical advice. Psychological support is often overlooked in TB care. The disease can cause deep emotional distress due to social stigma and isolation. Many patients feel ashamed or fear discrimination, leading to depression or anxiety. Counseling and support groups can help break this isolation, providing comfort and a sense of belonging. Sharing experiences with others going through similar struggles helps patients stay committed to their treatment and see hope in recovery. Awareness campaigns should also target communities to remove stigma and encourage compassion for those suffering from TB. Children with TB require special attention. Their immune systems are still developing, making them more vulnerable to severe forms of the disease, such as TB meningitis or miliary TB, which spreads throughout the body. Pediatric TB can be difficult to diagnose because children often can't produce sputum for testing. In such cases, doctors rely on X-rays, clinical symptoms, and family history to make a diagnosis. Treatment for children follows the same drug regimen as adults but adjusted for weight. Ensuring that children take medication daily under supervision is critical because missing even a few doses can lead to complications. Parents play a key role in maintaining discipline during treatment and providing a supportive home environment. TB during pregnancy presents another challenge. The disease can increase the risk of complications such as premature birth or low birth weight. However, with proper treatment and medical care, most women can have healthy pregnancies. Doctors carefully choose safe medications to protect both mother and baby. Pregnant women with TB should also receive nutritional counseling to ensure they get enough iron, folate, and protein to support their immune system and the developing fetus. One of the lesser-known facts about TB is that it can also occur in animals, particularly cattle, through a related bacterium called Mycobacterium bovis. This form of TB can spread to humans through unpasteurized milk or close contact with infected animals, known as zoonotic TB. This is why pasteurization of milk and testing of livestock are important preventive measures. In recent years, Scientists have made significant progress in understanding the biology of Mycobacterium tuberculosis. Researchers have discovered how the bacteria survive in dormant states inside the body, resisting immune attacks and drugs. This understanding is helping scientists design better vaccines and shorter treatment regimens. Trials for new TB vaccines are ongoing, and if successful, they could revolutionize global TB prevention in the coming decades. The relationship between TB and HIV is especially concerning. People with HIV are up to 20 times more likely to develop active TB because their immune systems are weakened. TB is one of the leading causes of death among people living with HIV. Therefore, HIV and TB programs often work together, offering joint screening, treatment, and counseling. Antiretroviral therapy, ART, for HIV and TB medication can be safely used together under medical supervision, greatly improving survival rates. Community involvement plays an important role in TB control. Local health workers, volunteers, and NGOs often reach patients in remote areas where healthcare facilities are scarce. These community workers provide medicine, check for side effects, and educate families about hygiene and nutrition. Their efforts bridge the gap between hospitals and patients' homes, ensuring continuity of care. Without such community participation, many patients would be lost to follow-up, leading to incomplete treatment and further spread of the disease. Urbanization and migration have also influenced TB trends. In large cities, overcrowded living conditions and poor ventilation create ideal environments for TB transmission. People moving from rural to urban areas may not have access to consistent healthcare, making it easier for the disease to spread silently. Governments and city planners can help by improving housing conditions, sanitation, and air quality. TB control must be integrated into broader public health strategies that address the root causes of disease. Poverty, malnutrition, and inequality. Technology has brought new tools to the fight against TB. Mobile health apps now allow patients to receive medication reminders, report side effects, and stay connected with healthcare providers. Digital chest X-rays, artificial intelligence, and portable diagnostic devices are making early detection faster and more accurate, especially in low-resource settings. With the use of these technologies, screening large populations and tracking treatment outcomes has become more efficient than ever before. Recovering from TB is not just about completing medication, it's also about regaining strength and confidence. Many patients experience fatigue or lung damage even after being cured. Pulmonary rehabilitation exercises can help improve breathing capacity and endurance. Yoga and meditation are also beneficial for restoring calm and reducing anxiety after months of treatment. These practices can support both mental and physical healing, helping survivors reintegrate into daily life with renewed energy. People who have recovered from TB can become strong advocates in their communities. Sharing personal stories of survival helps reduce stigma and inspires others to seek help early. Governments and organizations often involve TB survivors in awareness programs because their voices carry authenticity and hope. When communities see that TB can be cured, it breaks fear and promotes testing and treatment. If you found this video helpful and informative, don't forget to like the video, share it with your friends and family, and subscribe to the channel for more health awareness content like this. Your support helps us keep spreading valuable information that can truly make a difference in people's lives.